We are on Chapter 3, Drug-Specific Information, Drugs on the Street Where You Live. This chapter highlights the different drugs, their names, their routes of administration, the uses, effects, and hazards. As you read this chapter, consider taking notes on the attached study guide for drugs, located in the Files under Handout menu on the left-hand side in Canvas. It's also attached to the module page of this PowerPoint. This study guide could be helpful to you as you study for the Chapter 3 quiz. In addition, if you are going to continue on in the Addiction Studies program, the study guide will continue to be important in other classes. This is a good time to mention your final project, which is a comprehensive research paper and educational PowerPoint on the drug of your choice. Instructions on the final project is in the Files menu under Assignments. As you read briefly about the various drugs in this chapter, consider which drug you would choose for your final project. The final project is due on December 13th and is worth 50 points. You are welcome to start ahead on all assignments, including the final project, and submit at any time prior to the deadline. For those of you who like to work ahead, this is a great opportunity to get the assignments done. I feel that I do need to mention that a discussion of specific drugs may be triggering to some individuals who are perhaps early in recovery or who may not be in recovery at all. I am mentioning this because you need to take care of yourself and seek assistance, support, or counseling if you begin to feel triggered by the discussion of drugs, their effects, and their routes of administration. A list of counseling support referrals is in the Files menu under Handouts if needed. This chapter is a pretty comprehensive description of drugs of abuse. This chapter can be long and intensive to read about the different drugs. If you wish to turn down your volume and just flip through the slides, that's perfectly fine, but this time this is a full lecture on the different drugs. There are a multitude of terms that are also specific to the drug and alcohol field. You will learn these definitions in this chapter. A great way to study clinical terms and language is to make flashcards to study from as you read. Lastly, every type of drug, excluding some of the newer drugs, will be covered in this chapter. Again, the study guide for drugs, the handout, will be used to structure your notes. The modern-day history of drugs began in the 1960s and 70s with the use of marijuana, hallucinogens, and other drugs became a major part of the hippie movement. Then in the 1980s, cocaine became popular. With the original thinking and common belief at the time was that cocaine was not addictive and only maybe psychologically addictive. It is fair to say that cocaine changed our entire outlook about addiction. Celebrity deaths highlighted the dangerousness of cocaine. The rise of synthetically produced drugs began during this time, and one of their early results was ice or methamphetamine. Meth is a longer-acting, cheaper, and synthetically produced drug. It could be made in small homemade labs and gradually took the place of cocaine and popularity of use. Even up to now, chemists can synthetically prepare different drugs that could get past detection methods with a change of a molecule or two. The newer synthetically produced drugs include bath salts, spice, and kratom. These newer drugs are not covered in your textbook. The health-related concerns of smoking marijuana, especially lung and throat cancers, has led to a marketplace of marijuana products that are ingested without smoking. Lollipops to chocolate bars, baked goods, and oils, all infused with marijuana, are becoming more and more available. Some are with very high concentrations of THC. Energy drinks are classified as dietary supplements and so avoid the FDA regulations. They are not classified as drugs then under the FDA regulations. Crystal methamphetamine, its use becomes compulsive very quickly. The populations using methamphetamine today are a variety of different population groups, including those who are homeless and runaway youth, commercial sex workers, and traffickers are also known to use methamphetamine. The use of methamphetamine by girls in adolescence is primarily used for weight loss purposes. Girls are more likely to come to treatment than adolescent boys. The smokable use of methamphetamine can lead to runs of use of 4 to 5 days without any sleep and often without water or even food. Then a crash of 4 days or so occurs before the user begins another run. Although users of MDMA or ecstasy perceive it as harmless, there are reports of cases of acute and chronic paranoia associated with use and even panic reactions. It is considered a CNS, central nervous system, stimulant, and the effects are similar to other stimulants. Oxycontin is effective and beneficial for chronic pain sufferers. Think cancer, back surgery, other extensive orthopedic damage, and medical conditions of pain. Because it is long-acting and timed released over 12 hours, patients only need to take it twice per day. As we all know, we are in an opiate epidemic, fueled by the prescription medications such as oxycodone. In comparison to OxyContin, which needs to be prescribed or which had a high street cost, heroin is relatively inexpensive and easily obtained. Many users of prescription opiates turn to street heroin when the prescription painkillers became unavailable. Remember, when the supply side changes without the demand side keeping pace, individuals just change to another drug. The number of overdose deaths from all opiates now has surpassed the annual number of deaths by motor vehicles. Whole communities have been impacted by the opiate epidemic. See the handouts in the Files menu under Chapter 3, under Opiates, to review the data associated with the state of California and with the county of San Luis Obispo in particular. The opiate dashboard for San Luis Obispo is located at different websites: www.opioidsafetyslo.org, www.slowhealthcounts.org, www.livestories.com, and also https://California Opioid Safety Network.org. See the handout articles on dust-off sudden death syndrome in the Files menu on the left-hand side. Many parents have stereotypical views about inhalants and don't consider them as a potential cause to unusual behavior in their children. Consider the use of flashcards to learn the terms associated with substance use disorders. Under the cross-tolerance definition, I added the last part. It's usually when use of one drug creates a diminished or reduced response to the effect when a history exists of using another drug in a similar drug family. A common cross-tolerance is opiates with alcohol. Both are depressants. If a person regularly uses alcohol, they may have developed a higher tolerance for alcohol. And then when a medical doctor goes to give the same patient painkillers, they may need more opiates than a person who does not regularly use alcohol. Even though the drugs, alcohol and opiates, are not used at the same time, they have similar mechanisms within the brain, and this causes the cross-tolerance. Antagonism is a useful term to understand because many medication-assisted treatments are now available, and they are antagonists to the original drug of choice and can help in the process of recovery. Inhalation includes both snorting and smoking of the drug. Skin absorption. Consider the marijuana oils rubbed onto the skin as a route of administration. It is surprising to me, but the fastest route of administration is actually inhalation. Smoke the drug. Then injection is the next most rapid route. Several factors, however, determine the rate of absorption, including the route of absorption, but also the dose of the drug, the dosage form, whether it's pill, capsule, liquid, the injection type, spray, patch, or gum. For the desired effect or effective administration, the drug must be absorbed in an adequate concentration over time and must reach the desired site of action. See page 72 in your textbook for more discussion on this. Known as the 3 C's definition of addiction, as developed by Dr. David Smith of the Haight-Ashbury Clinic. In Chapter 4, we will cover the more clinical definitions of addiction through a review of the Diagnostic and Statistical Manual, DSM-5. So the 3 C's definition includes compulsion, control, and consequences. Drug is most simply defined as a non-food substance intended to affect the structure and function of the body, most often to diagnose, cure, mitigate, treatment, or prevent a disease. We are going to review each drug classification in a little bit more detail. It may be helpful now to use your study guide to take notes in order to study from, and you may also then have a nice list for other classes in the Addiction Studies program. Narcotic analgesics means narcotic means to numb out or to be in a stupor, analgesic to relieve pain with producing unconsciousness. Includes natural opioids, synthetic and semi-synthetic types. The appropriate use of narcotic analgesics is for the relief of pain, cough suppression, and sedation. Overdose and death occurs from the respiratory depression effect. Of course, I'm sure that you all know the names of various alcohol substances, including liquor, beer, and wine. You probably even know them down to the brand name, Smirnoff vodka, for example. The usual route of administration is oral drinking. Alcohol is metabolized at a relatively constant rate, which depends upon the weight of the individual. I think that most people would say the use of alcohol is to relax, lower inhibitions, making them feel more confident in social situations, inducing talkativeness, and making the person appear more expansive. However, overall, the effect of alcohol action is one of a depressant. It slows things down, reduces performance in tasks requiring physical and mental agility, alters perception, and blurred vision. The bodily functions are also depressed. Think breathing and heart rate, etc. As you probably know, tolerance develops in individuals who use alcohol regularly, meaning they need to increase the amount of alcohol they consume in order to get the same desired effect. Eventually, alcoholics need to drink large amounts in order to just feel normal and function. There are many diseases associated with the long-term use of alcohol, such as cirrhosis of the liver, wet brain, and pancreatitis. Another CNS depressant is the barbiturate. Perhaps the more well-known are phenobarbital and seconal. Usually taken orally, barbiturates are readily absorbed by the stomach and small intestine. The short-term effects are very similar to alcohol. However, in larger doses, the purpose is to fall asleep, producing a peaceful calm. The potential for overdose, respiratory failure, coma, and death is high. Withdrawal symptoms do develop with the regular use of barbiturates. Minor tranquilizers, or benzodiazepines, are used as anti-anxiety agents. They reduce anxiety and tension. Major tranquilizers are used over the long term for serious mental illness, such as schizophrenia, are also antipsychotics. The major tranquilizers do not produce pleasant psychological symptoms, and they are rarely used non-medically, so they won't be covered here. See the second slide for a listing of names of the major tranquilizers. Minor tranquilizers, such as those listed above, are usually taken orally as tablets, capsules, or liquids. Occasionally, they are injected. The effects of benzodiazepines within normal therapeutic dosages: the patient feels normal, feels well and relaxed, and may lose some of their inhibitions. In higher dosages, patients may feel sedated, may have a sense of floating. Some depression of nervous and muscular activity may occur. Mental confusion, lethargy, and rage reactions may occur in high doses. The margin of death between the low dose and the high dose is high, so that usually death does not occur by benzodiazepines alone. Rather, only when used in combination with other drugs, such as tranquilizers, opiates, and alcohol. Here's the list of major tranquilizers used for serious mental illness symptoms. In this section, we will cover the CNS stimulants, which includes amphetamines, methamphetamine, cocaine. Other stimulants, such as caffeine and tobacco, will be similar in effects, but much milder. Until recently, amphetamines were prescribed widely for obesity, depression, and narcolepsy. In the 1960s, intramuscular injection of amphetamine and methamphetamine became common, partially due to the stockpiles of amphetamines used in the military were diverted to more general use. However, in 1972, the government took over control of stimulants and designated it a controlled substance, and the general population usage decreased by 80%. Today, stimulants are prescribed for ADHD behavior in children, such as Ritalin and Adderall, short-term weight loss, and narcolepsy. Amphetamines are available in a wide variety of forms. Tablets and capsules are the most common. Amphetamines are usually taken orally or through IV injections. Methamphetamine, speed, crank, ice, is usually in powder or crystal form and is made illicitly. Since it is made illicitly, there is no medical use of methamphetamine. Methamphetamine is smoked or taken IV. The effects of the stimulants: increased blood pressure, widening of the pupils, increased respiratory rate, depress the appetite, relieve sleepiness, and decrease fatigue. Increased awareness and self-confidence, increased talkativeness, and reduced nausea and gastrointestinal upset. Hazards of the stimulants include agitation, heart palpitations, inability to concentrate, anxiety, confusion, blurred vision, and tremors. Higher dosages can cause severe hazards such as rapid breathing, agitation, panic, hallucinations, delirium, convulsions, and seizures. Death reports are rare, but they can occur in those already susceptible to cerebral vascular accidents, such as burst blood vessels in the brain or in the heart. Chronic long-term use of amphetamines can result in dehydration, severe weight loss, vitamin deficiencies, and reduced resistance to diseases. IV usage can occur with HIV, hepatitis C, and abscesses. The cocaine user experiences 15 to 30 minutes of excitation and euphoria, tends to talk a lot, and feels energetic and self-confident. Cocaine is a very short-acting substance, but then depression, nervousness, fatigue, and irritability sets in. The hazards of cocaine use with regular heavy use, depression and anxiety can be so severe that the user continues to smoke every 20 minutes or so for several hours to avoid the onset of that depression. This pattern may develop into binges of cocaine use. Another method to take the edge off of cocaine is to inject heroin with cocaine, called speedballing. Addicts frequently turn to the sedative hypnotics, alcohol, tranquilizers, and barbiturates to counteract the downside after using cocaine. Tobacco is the most widely abused drug. Despite warnings regarding the health hazards, approximately 70.3 million Americans, 29% of the population aged 12 or older in 2004 used tobacco. You know tobacco products names: cigarettes, cigars, smokeless tobacco, and in pipes. Tobacco is the single leading cause of preventable death in the country. On the slide are the diseases related to smoking tobacco. There have been a decreased use of tobacco products in recent years, yet youth-related tobacco use continues to put them at risk of developing smoking-related diseases. Nicotine products are used for their perceived stimulating effect. It does cause elevation in heart rate and in blood pressure. Caffeine occurs naturally in the leaves, seeds, or fruit of more than 60 plant species, including coffee beans, tea leaves and buds, dola notes, cacao beans, yerba mate leaf, generally thought of as coffee, tea, cola, and chocolate. Much of the published research about caffeine suggests that it is beneficial in moderation. However, some studies highlight the potentially harmful effects of caffeine. A high caffeine intake may worsen symptoms of depression and anxiety. There is some evidence that caffeine may impair insulin action, relating to a small but detectable rise in blood sugar levels, particularly after meals. Women should limit their caffeine intake during pregnancy, which could lead to loss of pregnancy, delayed fetal growth, and abnormal fetal heart rhythm. Also, caffeine passes into breast milk in small amounts and may build up in the nursing infant. Caffeine can significantly disrupt sleep up to 6 hours before bedtime. A person is unlikely to die from consuming too much caffeine in the diet. Vomiting would most certainly occur before a person had a chance to consume a fatal overdose of caffeine from dietary sources. However, pure caffeine can be dangerous, even life-threatening, and should be avoided. Anyone wishing to give up caffeine should cut down over a few days rather than at once to avoid uncomfortable symptoms of withdrawal. The term hallucinogen is derived from the Latin word hallucinare, which means to dream or wander in the mind. Another term describing hallucinogens are psychedelics. The hazards of hallucinogens include accidents are very common under the influence of hallucinogens, such as walking through plate glass windows, suffering accidental falls, drowning, and car accidents. Hallucinogenic effects can last from 4 to 6 hours or 12 to 24 hours. After such usage, the user is usually very tired, which necessitates a period of time to get back to normal. Researchers have identified over 300 cannabis products known as cannabinoids. The active ingredient in cannabis is THC, standing for tetrahydrocannabinol. Cannabis grows in most parts of the world. Routes: cannabis can be smoked in hand-rolled cigarettes or joints, or smoked in a pipe. It can also be eaten in cookies, brownies, and other food, or made into a tea. The effects of cannabis depend upon the potency of the drug, the method of use, and the experience and expectations of the user. For low-dose periodic use, the common effects are intensification of thoughts and feelings, feelings of relaxation or giddiness, minor increase in heart rate, drowsiness, dry mouth and throat, and red eyes. Subjective reports of the effects of cannabis include happiness, warmth, conviviality, and the ability to enjoy music. Cannabis has also been classified as a mild hallucinogen. The tars in cannabis smoke are 50% greater by weight than tobacco tars and 70% higher in cancer-producing substances. Considering that marijuana is inhaled deeply and held in the lungs, the cancer-causing risk is increased in marijuana smoking. Long-term use is associated with bronchial problems, sore throat, and chronic coughing. You can read about the other hazards in your textbook. With the legalization of marijuana, I would point you to the effects related especially to impaired driving. Inhalant use is more common in young people, people of color, and those who cannot afford the price of drugs. Known as a cheap high, inhalants often escapes the detection by parents and others, and the popularity of the various substances inhaled have varied over the years. See some of the articles on inhalants in the Files menu under Handouts, and then go to Chapter 3. Users of inhalants report a feeling of well-being, a reduction of inhibitions, and an elevated mood. These effects are similar to alcohol. An inhalant's effect may last anywhere from 5 minutes to an hour, depending upon the substance and the dosage. Why do young people use inhalants? To seek the altered feelings, such as being dizzy, mood elevation, and for fun. Number 2, for peer group influences. Number 3, its cost effectiveness. And number 4, its easy availability. Long-term effects, however, of inhalants include loss of appetite, weight loss, ulcers around the mouth. Most of these effects will disappear when the use ceases. Additional effects depend upon the specific product and their chemical makeup. Classified as a substance unto itself, PCP was developed in the 1950s as a sedative, general anesthetic, and analgesic. It worked fine as a painkiller, but had side effects: visual disturbances, severe agitation, and other unpleasant side effects, so that it was discontinued use by humans. PCP is a white crystalline powder soluble in water. Sometimes it is combined with other drugs, so it is hard to determine what effects are due to which drugs. It produces a state of euphoria lasting 3 to 5 hours. With high doses of PCP, accidents are common, especially drownings. Also, in very high dosages, the use of PCP may result in convulsions or coma. Young people, as well as many professional athletes and performers, use steroids for the enhancement effect of their performance in sports. A surprisingly large amount, 33% of adolescents who use steroids use them for appearance. There are different types of steroids: ergogenic, androgenic, and anabolic types of steroids, mostly used now in combination called stacking. Usual routes are injection or oral, as in tablets or capsules. See the side effects listed on the slide. The hazards are that steroids do not act on only one muscle group at a time. They act on all muscle groups. In adolescence, the drugs can cause stunted growth and the premature closing of growth plates. Other problems in men: breast development, acne, baldness, reduced sex drive, headaches, and nausea. For females, infertility, breast atrophy, menstrual irregularities. More recent research indicates the primary hazards may be psychiatric. Extreme aggressiveness, depression, mood swings may be the result of steroids. Over-the-counter medications are those that you can buy over the counter and are not prescription medication. Bath salts are usually white or brown crystal-like powder and are sold in small plastic or foil packages. Use of bath salts sometimes cause severe intoxication and dangerous health effects. Reports of people becoming violent and psychotic. Bath salts can be swallowed, snorted through the nose, inhaled, or injected with a needle. Snorting or injecting is the most harmful. Spice is often called synthetic marijuana or fake weed. The chemicals used in spice are stronger and have no medical benefit. Many of the chemicals are illegal. Some spice is disguised as incense. Many sellers claim that spice is natural and therefore harmless. Most people smoke spice by rolling in papers or as liquids to vaporize them in e-cigarettes.